It's a pleasure to meet you, Margaret Chen. My name is Megan Farraher, and I'm happy that you asked my opinion of the opioid epidemic. Opioid addiction has become a public health crisis in the past few years because of the rapid rate at which people are using these drugs. This outbreak is particularly hard to tackle from an epidemiological perspective because there are so many components to how people obtain the drugs, why they use them, and how quickly they become addicted. Addiction has infiltrated all social classes, races, and ethnic groups. We are in great need of additional funding to help tackle this crisis and prevent a new wave of opioid addiction. The cause specific mortality rate for Massachusetts in 2015 was 1,132 per 100,000. Both prescribed and illegal fentanyl are included in this death rate. The U.S. average opioid overdose mortality rate was 16.3 per 100,000 in 2015. Most recent statistics show a prevalence rate of 500 per 100,000 male opioid-related hospital discharges in 2015 and 350 per 100,000 female hospital discharges due to opioid-related admissions in Massachusetts. When adjusted for age, 2,000 per 100,000 hospital discharges for individuals between the ages of 25 and 34 were attributed to opiate abuse. Opioid use and addiction is creating an enormous public health threat. Many people are being exposed to illicit drugs, and with this influx of new users, there are no longer enough medical providers and resources to assist everyone who needs attention. As public health professionals, we need to ensure that we continue to assess the opioid crisis, develop policies for change, and assure that these policies are relevant and efficient. We are asking specifically for funding to create community centers where those who have become addicted to opioids can access resources for rehabilitation. Examples of resources would include supportive housing agencies, family counseling centers, job centers, and local healthcare providers. Community resource centers should also include safe spaces for people to use and clean needles for injections to limit the amount of disease and overdose occurring from intravenous drug use. These centers would also include outreach by community healthcare workers to help those who have overdosed with the provision and administration of Narcan. With further funding, I feel that we could really begin to tackle this worsening threat to our communities.